everybody, welcome to week 6 of your nursing practicum course. This week we are going further into the topic of assessment and evaluation. We need to identify one method of assessing each of the 3 domains, and discuss why these methods would be effective and how you can use them as an educator. Okay? Now, I am really asking that you try to stretch yourself a little bit for this discussion question. Try to explore some assessment strategies that maybe you haven't used or you're not really familiar with. Use this opportunity to really do a little exploring, okay? And please don't everybody tell me that we can use simulation for all 3 domains. We all know that. But push yourself a little bit further and see what you can come up with. One assessment technique that I like to use in certain instances is concept mapping. And if you're not familiar with concept mapping, I am attaching a PowerPoint about concept mapping and then an article about using concept mapping to build clinical judgment skills. The article isn't too long, but I think it's interesting. And I like concept mapping because it really allows students to see the big picture, to connect components, to see relationships between things that maybe are affecting a patient. I used to use concept maps when teaching pharmacology. And so we do a concept map for each classification of medications, and our different offshoots of the main hub would be things like side effects, lab values, patient education, diet, food interactions, so things like that. And then you could really see, for instance, once a student did side effects, food interactions, labs, they really could take a look at what kind of patient education was needed. So it's especially helpful for visual learners, and actually formulating the concept map and filling it in is good for kinesthetic learners. So it's interesting. So, which leads us to the class question I have for you this week. So, quite a few nursing programs are going to using concept maps in place of traditional nursing care plans. And I'd like you to discuss one pro and one con to using a concept map in place of the traditional nursing care plan. So I want to see your thoughts, see what you think. Some of you may have used concept maps in place of nursing care plans in your clinical, or some of them might be seeing them used in your practicum. So I'd like to talk about it a little bit. All right, one more point that I'd like to bring up. Usually at this time in a typical GCU course, you've passed the halfway point, you can see the finish line, right? Beginning of week 6, hey, we're getting there, we can do it. But in our course, you're only about, a third of the way through. You're trying to juggle work, family, class, practicum. It can be exciting at this point, but it can also start to be a little bit either discouraging or overwhelming, okay? Because you're trying to balance all these things. And we still have quite a ways left to go in the course, right? So my best advice is to, first of all, be patient with yourself. And second, ask for help in parts of your life where that's possible. You need to let people know what you're doing so they can have realistic expectations of you. Prevention of people being angry at you or disappointed, or prevention of that, is much better than actually having them be angry and disappointed. So just something to put out there. And also, if you can sneak in something nice just for yourself, a yoga class, a massage, reading a non-nursing magazine, just something like that, to take a little bit of care for yourself can go a long way. All right, so we are also in week 6, an even week, which means that your NEPD will be due again this week. A couple quick things. Make sure that you read the feedback in the faculty comments that I wrote at the end of week 4 when you turn them in. So if there's anything you need to address. And then please make sure at the end of week 4, I uploaded your NEPD form with my comments in it. Please download that actual document to your desktop. Fill out the sections that you need to, and then upload that same document. A couple of you, I don't think, did that with the original NEPD that you filled out in week 2 or whatever, and so I couldn't see my comments that I had written before. And I'm teaching a lot of students right now between this and my other class, so I might not remember everything that I told you 2 weeks ago on your NEPD form. So if you could do that for me, I would greatly appreciate it. All right, guys, I think that's about it. I'll see you in the main forum.